Hi, I'm Dr. Schaller. I'm standing outside of Aurora St. Luke's Medical Center. Inside is where you would complete your transitional year residency program. Come along as we take a look inside. We are now inside the emergency department at Aurora St. Luke's Medical Center. It is here where you will do your 1-month emergency medicine rotation, as well as see and admit patients while on the internal medicine teaching service rotation. Behind us you will see the nerve center in the emergency department. It is here where physicians assistants, nurses, and health unit coordinators collaborate to make decisions about whether patients need to be admitted to the hospital. We will now visit the cardiac floor on the patient tower. This is the waiting room on the cardiac floor in the patient tower. Come with me as we take a closer look at a patient room. Outside each patient room is a workstation. We use these to access patients' medical records as well as lab tests and procedures performed. While a resident at Aurora St. Luke's, we commonly see and examine patients. Here you will see up to 10 patients per day, work closely with cardiology attendings and fellows in order to reach the goal of excellent patient care. We will now take a closer look at the resident call rooms. We are now on the resident floor. Each resident will be given their own personalized locker to store secure items. Inside is an example of a resident call room. Not fancy, but functional. And here is a linen closet with fresh sheets, pillowcases, and scrubs. And then along this way through the door, you'll notice we have individualized mailboxes for correspondence from colleagues and staff members. We're provided with a stocked fridge of cold beverages, a daily breakfast tray, and a lounge with couches and a television to relax during downtime. Adjacent to the resident lounge is the conference room. Here, residents, attendings, and medical students gather for morning report. Also, residents give presentations on evidence-based medicine and case presentations. One of the great things about this residency program is that we get a food allowance. Here at the hospital we have a couple options. One is the deli. I particularly like the sub sandwiches and milkshakes. Another option for food in the hospital is the cafeteria. Lots of options here. They make a great omelet, and it's fresh. One valuable asset we have at this hospital is the medical library. Our staff is very helpful in obtaining information. We also have computer access to online resources. Let's take another look at another area of the library. This is my favorite area in the library. Here you'll find current issues of a variety of different journals. It's also a great place to study. This is the Medical Education Conference Room. This is where we have guest lecturers speak on various topics in internal medicine. We also have resident presentations in this room. As a transitional year resident, you'll have many opportunities to participate in direct patient care. This is an example of a medical floor. Here we admit patients to the internal medicine teaching service. As a transitional year resident here at St. Luke's Medical Center, you will order many CT and MRI scans. Here's an example of a CT scan. St. Luke's Medical Center is often on the cutting-edge technology for both CT, MRI, and interventional radiology. After the scans are performed, we often review these studies with radiologists. This is an example of a reading room where we interact with radiologists to make clinical decisions. Here you see we actually have a high-tech 3D CT scan showing an image of a heart. We often use and reformat these images to help surgeons make clinical decisions. That concludes our tour of Aurora St. Luke's. I hope I have helped you gain an insight into what it's like to be a transitional year resident here. I am happy to announce that I will be staying on as a resident in the diagnostic radiology program because I have thoroughly enjoyed my experience here. I hope to see you soon.